Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Attention Deficit Hyperactivity Disorder Among Children and Adolescents in the United States, Trend in Diagnosis and Use of Pharmacotherapy by Gender. The authors of the study were interested in how diagnosis of ADHD in children and adolescents has changed over an 18-year period, and if the diagnosis led to medications being prescribed in pediatric offices. Currently, it is estimated that between 8 to 10% of children have been diagnosed with ADHD in the United States. The rate of ADHD diagnosis in children and adolescents aged 5 through 18 years has increased by a factor of 4.1 times from 1991 to 2008. The rate of prescribing medications for those diagnosed with ADHD has increased by a factor of 4.9 times during the same period. Also during this period, girls were increasingly diagnosed with ADHD and prescribed medications. This trend is evident as the male-to-female ratio of ADHD was 3.4 to 1 in 1991. This ratio narrowed to 2.2 to 1 by 2008. The authors explain the increased rate of ADHD diagnoses to a change in symptom description over the years, where a focus has been placed on the attention deficit. This change in focus is why girls are more frequently identified than in years past, as girls tend to manifest ADHD through inattentiveness and cognitive deficits, while boys are more likely to have behavioral disturbances. The takeaway is that the rate of ADHD diagnosis has risen over the past 2 decades due to a change in focus to the inattentive symptoms of the disorder. This has resulted in more girls being identified. There has also been an increase in the use of medication for the disorder. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.